Medially, you have the patellar tendon. So this structure here, in most patients, you're able to feel the outline of their patellar tendon. And if a patient has pain in one area or the other, you can make them feel better by going to that side. I don't think it actually matters.
I think it's better to have their leg dangling versus like on the stool and supported.
I think so. Also, I'm able to, as I'm doing the procedure, if I'm hitting a lot of resistance and I can't get into their joint space, I have control. And I sit in front of them with my leg touching there so they can't kick me. I've been kicked. The other thing with a lot of patients, I give them the option to use lidocaine. It burns, and it burns for 10 seconds, but then it anesthetizes the area. With stem cells, I don't do local in my tract. I don't want anything in the joint space in the stem cells other than preservative-free steroids. So you could tell the patient you'll anesthetize the skin and it won't hurt, or you can just quickly take your needle and go through the skin. I think the trade-off is about the same. If I'm doing a typical knee injection, or if I'm trying to actually do an aspiration, then I will actually anesthetize the tract. So I'll go in with my skin needle, and then I'll take that same needle and actually go in the trajectory that I plan to do for the injection itself.
Okay, with using ISOView stem cells.
Yeah. I dilute it, so I'll take it just because the less we don't know all the stuff that's harmful in the long run to stem cells, but the less the better.
Like 50-50.
I bailed on being your assistant, sorry. I'm not videographer.
So when you thaw stem cells at room temperature, it takes a few minutes.
Yeah, it's gonna be a few minutes, but we're just gonna set up.
So preservative-free statement. I do about a 1-to-1 dilution, or 2-to-1 depending on the joint.
So you wanna get that side?
Regardless of the pathology, whether it's arthritis, any sort of soft tissue or arthritis, there is always something missing for right in the joint space.
So if they have intra-articular pathology, then I'm going intra-articular for my actual procedure. If a patient if they have a normal MCO, the patellofemoral compartment is normal, everything is fine, then
Doctor, can you tell us what gauge needle you're using?
so I'm using a 25 gauge, 1.5-inch needle.
That's a kind doctor there.
When all you're doing is injecting a fairly liquid solution like this, you can use a really tiny needle. If you're doing the Hyligan or some other things, you do have to use bigger needle. That's there.
I think 25 is good so you don't disrupt the cell.
So this is where I plan to go.
So what are you palpating?
So I'm palpating for the joint space where you have the femoral head and the tibial plateau come together. If you actually straighten the patient's knee, you won't feel as much space. And then when you flex their knee, you'll actually feel that space open up.
You want to tell me where your patellar tendon landmark is? Or
So the patellar tendon is more medially. If you are too medial or you're going too straight, then you'll actually hit the patellar tendon. It's very hard to go through, and the patient will not like you.
Please don't do that.
So I just do a small skin wheel. I'm right-handed, so my left hand serves as my stabilizer. I tell the patient you feel a small pinch or burn, or I'm injecting, or whatever it takes. Some people don't want to know anything, so you just poke them.
I don't give anyone manicure.
So lidocaine takes a minute or so maybe to work. You actually have to give it and let it work.
Did you want to wipe it with alcohol? So we're going to talk about septic technique in the joints.
So when you're doing procedures in the joint, you want to be as clean as possible. The idea is the area where I plan to enter, nothing touches that is not sterile. So you go in through the skin, you're going into the joint space. You should be perpendicular with the ground if you've actually opened up that joint space, and it actually goes in nice and smoothly. About an inch and a half in most patients You can aspirate with this needle. You're not going to get much fluid back. And when you inject, it should not cause discomfort to the patient. Maybe some fullness.
Yeah, it causes just,
What's it feeling like?
huh? It hurts.
Burning or?
It's okay. No, it definitely hurts. My knees are awful though. My knees are just, I'm okay.
Doctor, you
And
have
so-
patients that get more pain after or less pain with stem compared to PRP and that kind of thing?
So with stem, people typically have a flare in their pain for a few days. You're not giving anything particular to the beam of the ultrasound. So
On the bad arthritic ones, you'll see a big black
that little bit of gauze.
fluid there, which makes it really easy to see where to put the needle. You have that.
Are you gonna wipe that?
It's good to do, but harder to find the black.
Well, here's an idea of
So I don't really like going transverse in ultrasound unless I have to, just because it's already hard enough to find your needle on ultrasound.
Gonna wipe it off?
And when you go in a transverse approach, all you see is a little dot. And yeah.
see the full needle.
So on this one, you go above the patella.
So are you gonna give her lidocaine again or?
I am.
You're getting your own product.
I know.
How's your right knee?
Huh? It's okay. It's okay now. It was a lot of pressure going in.
You gonna go to the strip and go dancing now?
So I
Do you
think,
normally inject, you're thawing and you inject right away? 'Cause
Yeah.
That's what we do.
yeah. And so, I mean, here you have to source everything and get it all
Right.
wherever you are. But when I'm in my office, I have everything there. So I already mapped it out. I plan to go about here, but if you want to be certain, a centimeter lateral and a centimeter deep is where I plan to enter the skin. And so you can use something to make a little small mark. Typically a fingernail is all you need. And then small little pinch here. I already wiped. You okay?
It's not the one that hurts.
Do you feel like the lidocaine made much of a difference with the pain relief for the procedure, the comfort of the procedure?
Just at the level of the skin.
It's fine now.
So this here. And then let me get one of these. No stress. So because you want everything to be as clean as possible, and anytime you're going anywhere in the body, it never hurts to clean too much. Everything for every patient should be new and specific to that patient. So this is the skin entry site. I've already cleaned it, I've numbed it, but I'm using chlorhexidine now, which is even better than alcohol, and nice wide prep. If I were doing this in the OR, I would like do a bigger prep, but in the office, we take things a little bit slower. So my gel is going here. This is sterile gel. The ultrasound probe is not going to contact the area where I plan to inject, but you still want to have everything nice and clean. And so again, pressure here.
Can do to make this easier is wrap that around.
And then skin entry.
There you go. There you go.
So there you can see the needle. And I can actually feel that I'm against the patella, so I need to actually come back slightly and angle a little bit more. And then As you inject, you see that fluid bubble, and it should be going more toward the right of the screen into the joint space. Do you guys see that change?
Yeah. Nice job.
So the thing about it, once you know you're in the joint, you can take the ultrasound probe away, and you're done.
That one didn't feel the pressure the same as the first one.
Even if light in here.
Relax on your
Oh, yeah.
knee here. Oh, yeah. I usually just close my eyes and stand across the room.
That's what everyone wants to hear. So what do you say to docs that think they have to have an ultrasound machine? Because I get asked that a lot, and I've told them I've seen plenty that do it without one.
I think you do need ultrasound sometimes. It depends on the lesion that you're treating, and it depends on how difficult it is to navigate to the joint. Some places don't actually have good bony landmarks that you can palpate, and sometimes you really need to be precise depending on what else is in the vicinity. So if you want to really stay clear of some arteries or nerves or things like that,
Okay.
the knee is pretty exposed, so it's not, and the landmarks are very easy to feel, so you don't really have to worry about that too much. Okay, take a deep breath and just relax. Think about how wonderful this is. Oh, perfect, he's sleeping. Okay.
Just watch that hummingbird.
Oh, nice. Okay. Okay, so a little pokey. Okay, you're alive. He's enjoying this. He's smiling. Okay, so that's your knee. So your space is a little narrow. I'm going to stop there and give you some. Can you feel that going in?
Yeah,
Does it feel like pressure?
a little bit of pressure.
You okay? Because now all we have to do is get it out of there. Just a second. And we're done.